Hi, this is Dr. Luke from InMotion, and I'm here to talk to you today about one of the most common shoulder complaints that we see in our practice, which is impingement of the shoulder. So we'll start with a brief review on anatomy of the shoulder. So when we talk about a shoulder, we're talking about a complex of joints. There are four of them actually. We have the ball and socket joint that most of us think of as being the primary shoulder joint. There are several more. So at the top here, we've got an acromioclavicular joint where our collarbone meets up with this hood of bone, which is part of the shoulder blade, the acromion. So an AC joint. We have a sternoclavicular joint in the front here, where the collarbone meets up with our sternum. And then we have the articulation of the joint where the shoulder blade itself attaches to our rib cage. And the shoulder blade is really the important functional unit of the shoulder. And we're going to see that that is a large part of where most of our shoulder problems come from, is positioning of that shoulder blade. So I said we were going to talk about impingement. Impingement, the word itself sort of means pinching. And so what happens is at the end of our shoulder here, we have this acromion making up the top part of the cup. And as our arm comes up, if we pinch underneath that space, we're going to pinch some of our rotator cuff tendons. And that's what impingement syndrome is. When we have impingement syndrome, we get pain in the top or front of our shoulder. That's often associated with an achy pain into the side of the arm. And one of the rotator cuff muscles likes to ache out there when it's being impinged. And so the anatomy there is complicated. The best way to describe how impingement syndrome comes about is for me to show you what happens when a shoulder blade gets tipped forward, okay? So if I take my shoulder blade and I tip it forward and I hold it there, my arm can only go so far before it runs in to that hood and impinges or creates a pinch. And so as I hold mine forward, my arm goes to here and it won't go any further without my shoulder blade tipping and letting my arm go the rest of the way up. Okay. And so if because of rounded shoulder posture from sitting at work, that tips our shoulder blade forward, or arthritis or other injuries in the past, if your shoulder blade is sitting forward, you're going to be inclined or you'll be predisposed to having an impingement syndrome and pinching those poor rotator cuff tendons, some of which live in that space underneath there. So a complicated bit of anatomy, but a super interesting joint, the shoulder. If you're having trouble with your shoulders, come on in and see us at InMotion. Have one of our professionals here take a peek, and we'll see if we can find a solution for you to get you feeling better as soon as possible. Thanks again for watching this and for paying attention to our blog, and I hope you keep finding good information here from us at InMotion. Thanks.